Today, we are discussing a topic that we haven't delved into in detail before: anemia. Anemia, like many other conditions, is common both in our population and globally. It's part of a larger group of diseases or conditions mainly characterized by a decrease in hemoglobin levels in the blood. When blood is drawn, hemoglobin levels are measured. However, in addition to the decrease in hemoglobin per unit of blood volume, anemia is often accompanied by a reduction in the number of red blood cells. Thus, not only is the volume of hemoglobin in red blood cells reduced, but the number of these blood cells in our blood also decreases, leading to anemia. In cases of anemia, various changes occur in the red blood cells in peripheral blood, such as their shape, size, and hemoglobin content. These changes include the appearance of certain inclusions known as Jolly bodies or Cabot rings, named after those who discovered them. In some forms of anemia, nucleated red blood cells appear in peripheral blood, cells that usually do not have a nucleus but can have remnants of it, such as erythroblasts, normoblasts, megaloblasts, and immature forms such as polychromatic erythrocytes. Red blood cell maturation occurs in our bone marrow, and in peripheral blood, non-nucleated cells appear. It is evident that when red blood cells containing nuclear remnants or non-characteristic inclusions for non-nucleated red blood cells appear, a bone marrow puncture is performed to study erythropoiesis, or the formation of red blood cells. The goal is to determine if red blood cell production is reduced, hypogeneration, or increased, hypergeneration. In this context, the types of erythropoiesis are also determined: erythroblastic, normoblastic, or megaloblastic, on the basis of which diagnoses are established. This specific terminology is not very relevant at the moment. Our main goal is to understand what can lead to these serious diseases, which often can have a fatal outcome. For doctors, it is essential to clarify the medical history in many cases of anemia. Often, medical history is sufficient to diagnose anemia, and then further investigations must be carried out to confirm the diagnosis, as anemia has a well-defined classification. The first step is to investigate the patient with characteristic symptoms, which we will discuss later, and which are often related to poor nutrition. It is important to note that 85% of all known diseases in medicine are related to nutrition, which is the primary cause of these diseases. For women, it is very important to determine the number of pregnancies, if there is a current pregnancy, and if there have been GI bleeds or heavy menstrual bleeding. A thorough medical history is always collected, including questions about the number of pregnancies, abortions, how deliveries proceeded, if there was massive blood loss, and the duration of menstrual periods. To understand the development of anemia, we also ask about the patient's other illnesses and medications, as there is a broad category of medications, especially nonspecific anti-inflammatory drugs and anticoagulants, which can lead to a deficiency of iron and, first and foremost, iron deficiency anemia. We understand that poor nutrition, particularly during pregnancy, alcoholism, can affect the small intestine and contribute to a deficiency not only of iron in the body of a pregnant woman or a person who drinks excessively or eats poorly, but also of folic acid, which is vital for preventing anemia. So there are a variety of anemias, called folic acid deficiency anemias. It is evident that during the collection of medical history, and for people who present signs of anemia, we definitely pay attention to what surgeries you have undergone in your life. Since when you had the surgery, how you were operated, what types of surgeries, as surgeries on the stomach, intestines, especially on the small intestine, or the involvement of the small intestine, or even autoimmune gastritis, which can practically lead to certain types of anemias, especially iron deficiency anemia. As in the digestive tube, we have not only the production and consumption of iron, but also of vitamin B12, i.e. B12-dependent anemia. Also, of course, your dietary preference is investigated, because a lot of publications have been noticed in the world community that vegetarianism leads to the development, especially of vitamin B12 deficiency. As a result of developing anemia, it is evident that no matter how rapidly the symptomatology, which accompanies most anemias, develops, for example, the rapid development of anemia and jaundice, which accompany these anemias, are characteristic of hemolytic anemias, the so-called anemias. These hemolytic anemias can develop directly in the body, when the absorbed toxins practically destroy the red blood cells in the circulating blood, and everything that dies in circulating blood ends up in the spleen. The spleen starts to grow in size, and, of course, the excessive blood that passes from the spleen to the liver leads to the impairment of the liver, and it is clear that hyperbilirubinemia and the yellowing of the mucous membranes and skin are quite specific for hemolytic anemias. But if we are already talking about the different causes of the development of anemia, and no matter what anemia we are talking about, usually many types of anemias are characterized by a certain clinical symptomatology. In other words, complaints in cases of anemia or in the early stages are completely absent, because this condition develops quite slowly, meaning the symptoms worsen gradually, so at first complaints may be absent or may be so general that unless blood tests are done, this symptom can be overlooked. Therefore, among the common symptoms you observe are fatigue, weakness, headaches, dizziness, and lack of attention. Neurological symptoms such as chest pain and difficulty breathing, especially during physical exertion, are also added. It is possible that, after walking normally, you suddenly started walking a little faster and, for no specific reason, chest pain and breathing difficulties appeared. These are also signs of anemia. Heart palpitations are also an indicator of the development of anemia, although many of these symptoms, as you know, are characteristic of cardiovascular diseases. Patients notice that, during the development of anemia, intermittent claudication suddenly appears. When a person who has never had walking problems suddenly begins to have difficulty walking, then, as if nothing had happened, the problem disappears, that is, it is intermittent. Intermittent claudication is also one of the clinical signs of anemia. In addition, when you go to the doctor, he will usually observe paleness and tachycardia. The doctor will ask you about the headaches you felt in the heart area. Then, he will begin to auscultate the heart. Often, during auscultation, a systolic murmur can be heard, especially at the apex of the heart. This is because the heart, with its coronary blood circuit, in anemia, does not receive sufficient oxygen nor other essential substances for vital processes and biochemical reactions, as erythrocytes are carriers for these substances, which attach to their membrane through receptors. The signs of heart failure in cases of severe anemias are evident here, and, of course, as mentioned, jaundice and hemolytic anemias is also an indicator of this problem. But if blood loss is the cause, it can be either acute or chronic. In women, especially in cases of multiple pregnancies, frequent deliveries, heavy menstrual cycles, intravascular coagulation disorders, and other kidney function-related problems, spoon-shaped nails, known as the Koilonikia syndrome, can appear over time. Therefore, in cases of iron deficiency anemias, we pay attention to the shape of the nail bed and nails. When classifying these conditions related to anemias, we initially orient ourselves according to the size of the erythrocytes in routine blood tests. Depending on this, we can diagnose various types of anemias, such as microcytic, macrocytic, or normocytic. We also evaluate the level of hemoglobin and, based on it, establish the type of anemia, including thalassemia. There are also hereditary hemoglobinopathies, which are a distinct category of blood disorders. In this context, it is important to identify other specific signs that may require additional testing. A first sign we need to be aware of is the frequent appearance of cracks in the corners of the mouth in certain patients, which manifests as maceration, pain, cracking, difficulty in eating, glossitis, and dysphagia. These symptoms may also indicate an iron deficiency and can be observed in cases of iron deficiency anemias. So, there are a variety of signs, including changes in the appearance and fragility of nails, atrophic gastritis, and intestinal malabsorption syndromes, which can contribute to the development of anemia. It is important not to self-diagnose and consult a doctor for correct evaluation and adequate treatment. It is also essential to evaluate the medical history to identify any chronic illnesses that may be associated with various types of anemias. For patients with kidney disease, it is crucial to consider that in chronic renal failure, anemia is often the result of a decrease in erythropoietin production. In such cases, therapy with erythropoietin alpha may be necessary to correct this deficiency and prevent the serious complications associated with untreated anemia. So, we observe that practically any condition that can alter the quantity, quality, i.e. size and shape of erythrocytes, as well as genetic diseases, especially autoimmune ones, can influence the absorption process of the substances involved in the formation of erythrocytes, hemoglobin included, iron binding and others. These can naturally lead to anemias, which primarily cause a lack of oxygen in the body and manifest through the symptoms described above, which are common for many other diseases as well. It is extremely difficult to self-diagnose, and sometimes doctors, if they forget to send you for blood tests, try to do so, as it is part of the patient investigation algorithm. So, don't be surprised that, coming with a small problem, you will be sent to take blood tests, regardless of which specialist you go to, whether a surgeon, an infectious disease specialist, or elsewhere, especially in the case of infectious diseases, which are often accompanied by anemia. That's why, as we always say, any disease that actually leads to iron deficiency, folic acid deficiency, changes in the shape and size of erythrocytes, changes in hemoglobin content, is easier to prevent than to treat later and bring to hemoblastoses, i.e. blood disorders related to the impairment of erythrocyte stem cells, which already refer to our oncological diseases of the blood system and are quite difficult to treat. Therefore, we understand that, in evaluating our product, which we are discussing today, from the over 2,000 studies that allow us to speak about ACTIVIDAN not only as a food product, but also as a product that has unique properties and unique power to restore our body, it is better to be used for prevention rather than to treat already developed diseases. And from these over 2,000 studies, many are dedicated to the blood system, including the impact on erythrocyte stem cells, prevention of anemias we are discussing today, and, of course, blood disorders related to blast forms, i.e. oncological processes. What we already understand is that the development and maturation of erythrocytes take place in the red bone marrow, where the selection should take place through apoptosis to eliminate any damaged, modified erythrocyte that should not enter the blood, so we need to maintain complete control of apoptosis at the level of the red bone marrow. Any dysfunction there, and the specific structure is reticular, practically, you understand that macrophages in peripheral blood come to destroy the cell, but the cell itself must self-destruct, as apoptosis is the self-destruction of any modified or damaged cell as a result of any process. We always talk about endotoxins, exotoxins, i.e. toxic substances that enter from the outside, such as hemolytic toxins. So, or in the severe state of the body, when the toxic substances of its own can reach that same red bone marrow and actually cause modifications in the growth of erythrocytes and in the process of maturation of these blood-forming elements, and if everything works normally in our body, then modified or damaged erythrocytes are not allowed to enter the peripheral blood. All of these are apoptosis processes. So, our ACTIVIDAN, being absorbed into the blood, reaches the red bone marrow and controls all processes of erythropoiesis, leukopoiesis, and thrombopoiesis. And most importantly, circulating in the bloodstream, our ACTIVIDAN practically deals with restoring the walls of blood vessels. We have talked that very often, especially acute and chronic hemorrhagic anemias due to blood loss are associated with vascular injuries. And the more affected the vessel is, the more dangerous it is for life, because we all remember from the first aid course, and those who do not remember, we remind them. For example, in the case of aortic injury, the loss of 1 liter of blood leads to death because the pressure drops suddenly and practically there is not yet a significant amount of blood in the internal organs. But you still understand that in this case there is a decrease in the overall blood flow, which is not sufficient for oxygenation. And, for example, the injury of smaller vessels and the loss of half of the total blood volume. Death occurs due to acute heart failure, already with significant anemia of internal organs because the vessels in the circulation of the organs try to eliminate a large part of the blood into the general blood flow to avoid damaging the heart. But still, the blood is insufficient. So, you see, everything is interconnected. These are very complex mechanisms of the development of these pathologies, yes, in the case of hemorrhagic anemias. And we understand that in this case, a rapid decrease in the total volume of blood, both plasma and erythrocytes, leads primarily to acute hypoxia of vital organs. These are our heart, our brain, and nothing good for our body. That is, a cause of 100% disruption of the life process appears. But hypoxia, whether related to a gradual decrease in the amount of blood in our blood circulation, actually stimulates the production of erythropoietin, which is produced in our organs that are not involved in bone marrow hematopoiesis. Erythropoietin already stimulates sensitive cells of the red bone marrow. In our blood, there is an increase in the number of reticulocytes. That is, this is not a mature form of erythrocytes. Their quantity primarily indicates the state of hypoxia of the body. And the doctor needs to find the cause of this hypoxia. But we also understand that in this case, if we are already talking about chronic anemia related to blood loss, about chronic post-hemorrhagic anemia, then this usually affects women primarily. This is primarily bleeding from the uterine cavity, this is hemorrhoidal bleeding in hemorrhoids, this is bleeding in tumors, i.e. prolonged blood loss when blood constantly flows from decaying tumor foci. This is hemophilia, which as an independent disease can lead to and be accompanied by chronic post-hemorrhagic anemias. And this is the expressed hemorrhagic syndrome, which practically accompanies this chronic anemia. Pregnant and breastfeeding women are often affected by infections. There are anemias in this category that are caused by problems in the synthesis or use of iron, known as iron deficiency anemias. These can be of genetic or acquired origin, being transmitted through DNA and RNA. There is also a separate category determined by disorders in DNA and RNA synthesis, known as megaloblastic anemia, which requires different treatment. We understand that blood vessels are most affected in these conditions, with the appearance of hemorrhages and vascular lesions characteristic of anemias. By consuming ACTIVIDAN, we can control the apoptosis process, as well as the amount of blast cells, which are essential for the normal production of blood cells, especially erythrocytes. ACTIVIDAN helps the normal functioning of the liver and kidneys, stimulating the adequate production of erythropoietin, necessary for the formation of normal erythrocytes that transport oxygen in the body. It is important to maintain the health of blood vessels as they need to supply oxygen and nutrients at the cellular level. Even if there are internal processes that ensure oxygenation, such as the Krebs cycle for ATP production, it is crucial to take care of the health of blood vessels and the adequate composition of erythrocytes to avoid anemias. Our ACTIVIDAN improves the rheological properties of blood, thus preventing the agglomeration of erythrocytes and the formation of blood clots. By maintaining the rheological properties and the composition of the formed elements of blood, ACTIVIDAN contributes to maintaining the normal structure of blood vessel walls, which is crucial for microcirculation blood vessels. In the case of large blood vessel injuries or the development of aneurysms, ACTIVIDAN can be used to repair the vascular wall and prevent the rupture of blood vessels either for preventive or therapeutic purposes. This aspect emphasizes the importance of ACTIVIDAN in supporting medical efforts. We always emphasize that when the processes of iron absorption or the lack of folic acid are affected in the body, we start taking dietary supplements, sometimes without control, when in fact they should be prescribed by a doctor who monitors the doses. Our iron preparations are of valency 2-3 and are not efficiently absorbed in the gastrointestinal tract. Even our dietary supplements are no exception. Therefore, using ACTIVIDAN in addition improves the absorption and transfer of iron through the cell membrane, thus improving the normal formation of blood and its integration into our erythrocytes. Thus, the use of ACTIVIDAN together with dietary supplements or treatment for different types of anemias increases the absorption of substances necessary for normal hematopoiesis. We have already discussed that many infectious processes, especially long-term ones, lead to the development of anemia. In any case, they always appear to some extent, but are quickly eliminated, and everything returns to normal. Thus, quick recovery affects both the quantity and quality of the formed elements of blood, erythrocytes, and hemoglobin in our blood. But we should not allow the development of any processes that could lead to anemia. So, here we are talking again about prevention, and especially about the quick recovery of any infections in our body, and ACTIVIDAN is a helper because it has strong antiviral, antibacterial, and antifungal actions, reducing inflammatory processes and limiting inflammation. Because it is a powerful immunomodulator, it practically stimulates anti-inflammatory action according to the humoral factors responsible for the development of inflammation, attracting the formed elements from the bloodstream to those inflammatory foci. Here, a rapid wave of recovery is created, a rapid attraction and limitation of the production of inflammatory mediators that would otherwise affect neighboring tissues that should not be involved in the process. Everything happens quickly and regeneration takes place with the smallest possible impact, which is why the effects of ACTIVIDAN are very diverse. As an immunomodulator, there are no equivalents at present, as we use medicines that either stimulate the production or reduces the production of formed elements. As for substances that would directly influence humoral functions of the immune system and cellular composition, there are none, and ACTIVIDAN does not allow these functions to increase or decrease to critical values, maintaining both limits. If the level is high, it will reduce it, but not so much that the body does not have enough. If it is low, it will cause the red bone marrow and other organs, such as the peripheral lymphatic system, to produce enough leukocytes, go through normal differentiation to avoid causing other autoimmune processes and damage to our body. I reiterate, this is mainly the proper control of our cellular and humoral immunity based on antigenic properties, the ability of our body to fend off any external infectious attacks or even internal ones, as we sometimes encounter encapsulated forms that may cause us to develop any disease at any time. Practically, you understand that it is very important here. Many of our processes are accompanied by an increased consumption of oxygen. Oxygen deprivation for the brain, heart, and other vital organs is very important. There is an initial phrase regarding the impairment of many organs by other pathological processes, such as the decrease in the necessary oxygen requirements to ensure normal functioning. Therefore, our ACTIVIDAN effectively reduces the oxygen requirement of a tissue or another in the body, such as the heart, in many vital organs, and this is confirmed by numerous studies. Numerous recent studies confirm that fucoidants reduce the oxygen requirement of the cardiac muscle, thus prolonging the period before cell death and, implicitly, the cell's life cycle. If a cell dies, such as a cardiac myocyte, it cannot be replaced and only a scar appears. This aspect is crucial. Normally, the brain can function without sufficient oxygen for 4 to 6 minutes, sometimes even 10 minutes. Similarly, fucoidan stimulates the production of oxygen from glucose, xylose, galactose, and fructose, its components. Thus, fucoidan strengthens the Krebs cycle and supports anaerobic and aerobic glycolysis, which are essential for the production of substances necessary for cell function. These aspects are confirmed by numerous studies, including at the biochemical and morphological levels, in various diseases, highlighting the ability of fucoidan to slow down destructive processes and contribute to the recovery of damaged cells, maintaining their structure and functionality. Therefore, fucoidan can even have an anti-tumor effect, as anemias associated with tumors can worsen the tumor process. It is important to understand that oxygenation disturbances lead to cell death by necrosis, not by apoptosis. Our ACTIVIDAN plays a crucial role in preventing diseases, as none of us is immune to anemias, given the substances such as lead and others alike in our diet. There are so many hemolytic toxins at present, even the additives we use to enhance the taste of food, many of which have properties to destroy erythrocytes. Therefore, it is important to have a correct diet. I didn't tell you for nothing at the beginning of our conversation that anemias, especially those caused by the lack of substances in the body, are closely related to proper nutrition. It is crucial to have a balanced diet, consume enough water to maintain rheological properties, and of course, breathe clean air. Oxygen must arrive to you through the lungs in adequate quantities. Consume ACTIVIDAN to prevent the development of these diseases at any time. Women who plan pregnancy, subsequent childbirth, correct development of their hematopoietic organs during this exciting period of their lives, progeny reproduction must take ACTIVIDAN. The doses of ACTIVIDAN can vary. I tell you again. If everything is okay, the preventive dose for an adult is 5 mg per kilogram of body weight. If you take ACTIVIDAN from VIMGRACE, the high concentration of fucoidan sulfate is the main component. For each person, the doses can be increased, or you can drink much more depending on the specific diagnosis and duration of administration, of course, until the restoration of hemoglobin or until the qualitative change in the composition of erythrocytes, i.e., drink until everything is restored. It is advisable to continue drinking for a month, then switch to the maintenance dose. So, consume ACTIVIDAN, have it on your table so as not to forget to consume it every day. This food product is unique. Be healthy, and I'll see you next Thursday.